everyone, welcome to our in-service training meeting. We are here from the Pineview Risk Management Team. My name is Dana.
I'm Whitney.
I'm Carwin.
I'm Rachel.
And we are here to talk with you about decreasing patient fall rates at our hospital. We know that hundreds of thousands of patients in hospitals fall every year.
And 30 to 50% of these falls result in injuries, which can cause patients and hospitals more money and extend patient hospital stays.
Now, falls are considered never events, and so they're things that we do need to prevent. Currently what we see is that our current fall risk prevention is ineffective, and so that's why we've collaborated and we're bringing this new policy to you today.
So based on evidence, we're going to implement a new risk assessment tool that is the Morris risk assessment tool, and based on that, we're going to, every patient that is admitted, if they score above a 55, we're going to have them reassessed every 48 hours for their fall risk, and then we're also going to have them again assessed at discharge, and if they are of high risk and still need that further education and management of that and interventions, they'll be referred to their local healthcare providers.
Oh no. Oh my goodness, are you okay?
No, I fell when I tried to get up and I just couldn't
Oh
walk
my
right. My
goodness,
legs
I'm
gave
so
out.
sorry.
Yep.
Okay, so Miss Taylor, so my name's going to be Carwin. I'm going to be one of your nurses today. Now, before we get you into a room, I know you came in through the ER, but before we get you into a room, I need to do a fall risk scale on you, okay? So what I want you to do, I'm going to ask you a couple of questions and just answer them truthfully, okay? So the first question, do you have a history of falling, or have you fallen in the last 3 months?
Yes, I do.
Okay. Do you have any secondary diagnoses that puts you at risk for falling, like multiple sclerosis, broken hip, any knee surgeries or anything like that?
Nope.
No? Okay, good. And then let's see, do you use any kind of assistive device to walk? So like a walker or crutches or anything like that?
Yes, I have a walker.
You have a walker?
Take it everywhere.
Okay, did you bring it with you here today?
Nope, not here.
Not here. Okay. Well, you know, sometimes when you come in by the ambulance, it happens.
That's true.
Now, let's see. You came in through the ER, so do you still have that IV that
Yes,
they put
it's
in?
hep blocked right here.
Okay. All right. Sounds good. And then let's see. I saw you walking over here today, and you are a little weak when you do walk, but obviously without a walker, it's kind of understandable.
Yeah.
Let's see. And then just a couple of quick questions. Do you know where you are?
Alright, I'm at Pineview Hospital.
Okay. And do you know what day of the week it is?
I believe it's Monday.
And is Mickey Mouse a cat or a horse?
A mouse?
Very good. Okay, so we are good there. Let's see. So based on your assessment, it looks like you scored a 70, so that is a little bit high. So you are considered at risk for falls.
Oh no.
It's basically what it means is that we just need to be around to be able to assist you, like whenever you need to get up, like to transfer to a chair, or if you need to go to the bathroom. You'll have a call light though, and so just be sure that every time you need to move to get up and get around, just hit that button for us, okay?
So
And
you guys
we'll-
will come right over and then I won't fall.
Exactly. And we'll go over the scale periodically throughout your stay, just to see if anything changes, all right? Okay.
Thanks, Carmen.
You're welcome.
Miss Taylor, I'm just back to do another fall scale for you. I know you just had one the other day, so we're just going to go through it super quick, but just answer all these questions truthfully for me, okay?
Okay.
Do you have a history of falling recently
Yeah.
or in the last 3 months?
I do.
Okay. Awesome. You don't have any secondary diagnosis, like MS or broken hip or anything like that?
Nope.
That hasn't changed.
As a fiddle.
Do you have crutches, a cane, or walker, or any sort of aid you use to walk?
Yes, my husband brought my walker yesterday.
Awesome. Okay, your walker is here. And then, do you still have that heparin locked IV in?
Yeah, they haven't let me free of it yet.
Okay. And I did notice when you walked in here, your gait is about the same. It's still a little bit weak, but nothing too concerning. And now that you got your walker, you definitely seem to be doing a little better with that. And can you tell me your name?
Dana Taylor.
And where are you?
I'm at Pine View Hospital.
And who is the president?
Joe Biden.
Awesome. Okay, so it seems like your score is the same. So it is still a little bit high. Nothing to be too worried about, but we are going to keep doing periodic assessments until you're discharged.
Deal.
Thank you. Yeah.
Okay, so we just did your fall scale again, just to get you ready for discharge, and it looks like it's definitely down, which is awesome, but you're still at a 60, which we want, if you're above 55, we still, want to watch that. So we're going to refer you over to your local healthcare provider within the community, and he's just going to help you with more fall prevention, education, and whatever else you need with help.
Okay, perfect. Thank you.
Oh, and we're also going to give you some pamphlets just as you're going, just to help you with preventing that at home as well.
Great. That'll be awesome until I can see my provider. Hi again, everyone. I represented Miss Taylor in this little video we put together for you for these fall risk assessment trainings. And you saw in the video the assessments that the nurses did. They put those scores into the EHR, and because of their hard work, I did not experience a single fall in the hospital. And that's really what this project, this policy is all about. It's improving patient safety and improving our quality of care here at Pine View Hospital.
We hope that video was helpful and kind of gave you guys a much better idea of what the Morse Fall Risk Scale entails and how to go about this new policy. So we are asking, we've had our meeting here, and we are going to be having meetings with all the registered nurses throughout this hospital to be able to go over this policy and to help train them. We do understand that this is a policy that should be implemented by everyone, but that RNs are really the most important people in this, because we need to be the ones that are doing the assessments and are assessing our patients, as well as documenting these assessments so that we can understand our patients' fall risk and they can also better understand their fall risk.
So as the RNs all throughout the hospital are trained, our next step in this procedure is to have, like you saw in the video, each patient who is admitted have a fall risk assessment performed when they first get into the hospital. And so the registered nurses will administer that fall risk assessment, and then they will record the patient's score into their electronic health record.
And now, even though it might be tempting, we should remember that it is the nurse's responsibility to actually do this assessment. It can be very tempting to assign this to the CNAs, but under our hospital, this hospital policy, we actually can't do that. The nurses need to be doing every single assessment. And so just to kind of reiterate, if someone does score above a 55 on the Morse Fall Scale, we do need to do a repeat assessment every 48 hours at a minimum. Now this can be, before they go to PT or as soon as they wake up in the morning or whenever you give meds. It's totally up to you, but 48 hours is the window that we need to reassess.
And right before every patient is discharged on any of the units in this hospital, it is the responsibility of each registered nurse to reassess that patient using the Morse Risk Scale Fall Assessment tool. And if that patient scores above 55, or if there's any other concerns, we highly encourage the patients to reach out to local healthcare providers for any help and information that those patients may need.
Thanks for coming to our in-service. We're excited for our fall rates to drop.
And if you have any questions, be sure to reach out to one of us on the risk management team, and we'd be happy to help you out.